So my presentation really is about enabling communities to understand research and science and focus on methods and case studies. One thing that I want you to understand, as Lillian has said, really, she's done my work more easier. Public engagement involves various creative ways. Creative ways in which the activity benefits of higher education and research can be shared with the public. When it comes to public engagement, as Lillian has emphasized, there are many ways really to skin this cat. And engagement, by definition, is supposed to be a two-year process. That is very interactive. That involves listening, of course, and brings about mutual benefits. The most important thing for you to think about public engagement is to say, what are the benefits not for me only as a scientist, but also the researched. In recent years, scientists have been actually being challenged to say, can you not think of yourself as the guys who are sitting in the ivory towers thinking that you know everything? Come into communities and say, you know what, listen to me, I'm the scientist, I'm going to tell you what to do. So we are trying to really break barriers about this. And we are not saying you don't know what you're doing, we are simply saying your expertise seems to be different from what the communities know. It gives opportunity to co-creation. It gives opportunity to relevance in higher education. In most African countries, including Botswana, and I'm sure Uganda as well, the top question that has been asked has been relevance of higher education. When you are working on research, why are you doing it? Are you just doing it so that you can publish and then you get a promotion? Or do you want it to end in the community? Because science doesn't operate in a bubble. It's not complete until it reaches the society that is meant to be reaching or to be improving or enriching in terms of knowledge. So it somehow brings the aspect of relevance, ensuring that whatever that you're doing somehow speaks to the society that you are in as a scientist. It gives opportunity to people-centered projects. It refines local IP. Later in my talk, I'll somehow quickly touch about this topic of local IP, which speaks to really knowledge systems. It brings diverse skills together. You can think about it. When you're starting a public engagement project, first of all, you start thinking, who can I bring into this project? Is it the policymakers, communities, where in the community, who will I speak to in the community? Institutions, if you are coming from this institution, like a university for instance, you start thinking, okay, maybe I should start thinking about the private sector. Who in the private sector would start understanding my work and getting interested in it? So it really opens an opportunity to start thinking in terms of partnerships to bring diverse skills to scientific work. Lillian has briefly touched this thing about the relevance of public engagement. It strengthens science development. I liked what Professor Hoppers was talking about earlier about knowledge systems. If you look at the first topic there that I put about strengthening science development, it's actually speaking to these systems of knowledge to say, yes, we understand chemistry, we understand AI, we understand whatever scientific areas that we are having. But really, can we start inputting our own methods into it? Can we start putting our own recipes into it? And where is the recipe coming from? It's coming from the society that you are based in. If you bring approaches from the States, for instance, they might not work not working, not in terms of the chemical relevance, but in terms of societal acceptance. So if you omit public engagement, you might not have a very strengthened science development policies. So this actually gives opportunity to strengthen your policies in terms of uptake. It creates relevance, as I emphasize. Accountability to taxpayers. Can you imagine? Universities are getting funding from the government. People are getting paid. They are being funded to travel. But for what? The public needs to know and needs to understand why do we have to be researching at all. So public engagement gives opportunity to the public, society, to now see and look at you and ask you questions about where they are taking their money to. Research uptake. In a sense, from what Lillian's presentation, as she was going through, it says a lot that when it comes to science research, at what point do we start doing engagement? To me, I would say it has to start from the beginning. When you apply for that grant, before you even start thinking, okay, maybe this is the problem, look at the problem as a scientist and analyze and think, okay, this could be the problem, but where do I approach it? Bring many people and many partners into it, stakeholders, communities in it. Why are we doing that? So that in the process of scientific development, everybody is involved. We all know that science is not perfect. How many times have you heard that coffee is good for you? The following year is not good for you? We have seen points as Africans, we've been told circumcision is bad, and we lost it. Years later, they come back to say, oh guys, you're good. Hey, can we start doing that thing again? It actually showing that somehow research uptake can be easy if we involve communities. Because we all make mistakes. You cannot say, it's a scientist, we leave it to them. You know that your chief was part of it. Your government was part of it. Really. Also, in research uptake, it means if you have other stakeholders there, such as the policymakers, they would know about it and it's easy for them to fund it. If you have the private sector being part of your partners and your stakeholders, they'll see it and then somehow start infusing some of the research results into their businesses, or even find the same business to be, and it can easily now be adopted in the community. But here are the things that I want to emphasize, just so that this is not really a very, very complicated thing. Well, I think it's complicated, but I think in terms of, think of it in this way. It's fun. It's about dialogue. It's supposed to fascinate. It's supposed to be inclusive, and it's supposed to be creative. Creative projects, big art projects, could be a way to actually tackle public engagement. We've been talking about how the media is not part of this thing. The media, they're attracted to interesting things because their audience are attracted to interesting things. It means we have to make science interesting. And how do we do that? Is it by brochures? Do we just simply attend Malaria Day and then we provide brochures to people? Will that work? How many people read brochures when they get to their homes? We have to really think and dig deep about the kind of project that we do. And in those projects, make the media your partners. Art projects, for instance, big art projects, where the media is your partner and they know their role, they've got a stake and a role in the project. Either by way of dissemination, or simply ensuring that they become part of the process. So that when they report, when they write, they understand the process right from the beginning, so that they don't misquote or write whatever that's not relevant to your subject. Music and film projects. Scientists and business communities could be part of this. Community-driven projects, technology projects. I'll give you an example about this project, about that image. This is blood, by the way. This was by a British artist. What he did, he went to the clinic or the hospital to draw blood from his to get his own blood, collecting his own blood. At first they were refusing, they say no, it's unethical and all that. He said okay. He started doing it step by step, like for a period of 6 months. And then he made a mold of his face, casted this thing and froze it and put it in an epoxy. It was a big public issue. People were discussing, oh, this is so inhumane. This is so un-British. It's ungodly. But let me tell you what about public engagements. In this life, whatever that you do, it has to affect people emotionally, either positive or negative. If you find yourself in the middle, you're in a big danger. How many of you have had, let's say in the morning, a very boring song, but you find yourself singing it? You sing it to get it out of your system, to shake it out, but really it's not about that. It got you inside your brain. So your public engagement project somehow should touch on this emotion aspect through the creative process, so that people don't forget it. If it's just in the middle, it's likely to be forgotten. That's another interesting one, where small art projects, fun projects. There's another one that's a cartoon here by some artist. Climate change, for instance. We all know that there's a process that you follow when you're doing, when you cut down your trees, photosynthesis and all that. There's that scientific thing. But because you're bringing some artists in your project, they've got a way to decode the message. It's like artists, like editorial cartoonists. The whole story that you can write 10 pages out of, they will give you one cartoon, and you'll be able to understand what it means. It hits you right here. So this artist here, what they did, as you can see, they're trying to communicate a message about climate change. To say, if you cut down trees are your source of oxygen. But we know in science world this is not really how it translates. There are many processes in between oxygen and that. In 2016, I was in Mumbai. I came across this art installation project about an artist who wanted to communicate climate change. What they did, really, they took oxygen masks, planted them in a tree, and then the artist now chopped the tree almost halfway. That was almost falling. So when you come to the scene where the project is, to the installation place, what hits you right here is that, oh, if I cut this tree, it means I won't get supply of oxygen. We know it's not true, but that's how the brain communicates anyway. That's what at least science teaches us, that trees give us oxygen. But you see, this is the creative element of it, the emotion part. These are the partners that you can consider when you are creating your public engagement projects. As I said, policymakers should be part of your engagement process. Media people, scientists, everybody will end up understanding what you are doing and not misquote you, and also support your process or your project. I'll give a case study about a project that we did in Botswana, but it was between Botswana, South Africa, and India. Gaborone, Cape Town, and New Delhi. It was a street art project, what most people understand to be graffiti. You know that in every city, graffiti is seen as, graffiti artists, they are seen as vandals. What we are trying to explore here was to try to look at, okay, no, these are people, street artists are very interesting people. Most of the time you go around, you see street artwork, really on a controversial topic. But what we did, because they are seen as vandals, they wake up at night, they do this thing, tomorrow morning you find in your wall this message, it's either political, but we are interested in taking and harnessing this energy, putting it into science. So we brought them together with biomedical scientists to see what would happen, and other stakeholders, of course, through workshops, through fun events where they would interact and learn about each other. We introduced a concept of having the street artists spending time in the office with the scientists, and the scientists visiting the street artists, having lunches together. It was quite fascinating to actually come to learn the kind of questions that were emerging out of the process. And that is what we are interested in. So, in the end, we are focusing on in Botswana, we are focusing on 3 themes: hypertension, HIV, and the other one is mental health. It's not in the picture here. But this one was HIV. The artist here, this young lady, her name is Refugio. She drew a native man fighting with a spear. And the spear, she put a condom in it and tied it. And that's the HIV virus. And she said, silence the virus somewhere here. In the process of doing that, many people came and gathered. They started asking questions. What is this? What does it mean? And the fact that someone can come and sit and look at an artwork. We usually see these things in museums, where people sit and watch and look at an abstract thing, and we think, what are they thinking? It is our conviction that at that point, new thoughts are being generated out of something. If you think of thoughts as bubbles, they keep on generating, and that is what we are interested in. The fact that someone can come and analyze and deduce something, we don't care what it is. Whether it's negative or positive is not our business. What we want them to think and start the dialogue that I was talking about and asking the questions. The other guy was, I thought he was a very lazy, but that's my opinion. We encourage the artist's freedom in this process, and those were some of the principles that when you work with street artists, respect them, know that they are experts in their field, as much as they respect you in your field. So whatever the outcome, we are not really concerned about it. We're concerned in what they're going to say or put out there, and that's their freedom. So he did, I don't know what you call it, ECG? Yes. And then it was supposed to be hypertension. This is a picture of a man who's holding their heart like that, and showing that this thing is, the ECG is somehow, the person is endangered and becoming flat and all that. So yeah, that's a project we did in Botswana. It was a creative project to bring scientific, biomedical scientists and street artists, quite unusual people, because I believe scientists and artists, they're both creators. It's just that they do things differently. With artists, they don't follow a procedure that is like where the methodology and all that is a bit in reverse. You just put something out of your head and what comes out is new. We all see that artwork for the first time, The same with the scientists when they're producing a PhD or a prototype. Thank you very much.